who have the know-how to work in hospitals and currently are not doing so, to make sure the nursing profession, once again, is respectable. At the moment, many nurses are leaving the trade in favor of doing uvenda, if you like. Reason, they have found that they're being overworked, and yet the results from their work are not as they should.
Thank you. Thank you. You've mentioned the issue of retaining doctors.
Yes.
The issue of motivating them. Now, it's stated, and the research has shown that motivation is relative. What motivates Jack is not what will motivate James. How do you ensure that they come back, they remain motivated, they stay in the land?
I have an advantage in that I have had time to chat and to live with quite a few of these doctors. And what I've said here is indeed coming from them talking to me as somebody who is living in Malawi. Last year, I spent almost 9 months in hospital, having failed to be cured in a private hospital in Malawi, where I was told that all I had to do is take a lot of water, and yet my liver and kidneys were failing. If I hadn't traveled to Britain, I wouldn't be standing here today.
Thank you. Thank you. PPM?
Yeah, thank you. I'm sorry that I don't agree with all my colleagues. Why? They are coming up with very beautiful plans, but they are not telling the audience here where they are going to get the money from. Because all what they are saying has been tried and it has failed. The reason, people sit with our money in account number 1. When people out there are dying in hospitals, no medicines. First, as far as PPM is concerned, is decentralization. Financing of all ministries should be decentralized. Once we do that, people will be making their own money at local level. And once that is done, they will be able to support the hospitals, both government as well as charm hospitals. PPM is planning to reduce the radius of hospitals to 5. Currently, it is between 10 and 15 kilometers. That's how long sick people travel in the rural. I'm sorry, we can't manage our country like that. 3, we have to set up, and this is in our plan, we have to set up a national referral hospital. Equip it so well that all those people, even ministers, even heads of state, can be adequately treated in the national referral hospital. From there, we should conduct intensified training programs for Malawians in the medical industry. From there, we have to improve remuneration, pay them well. From there, let's look at where our money is going. 640 billion budget for this year. People are still dying in hospitals. Where is the money? Cash
Thank you. Thank you.
We can't move on like that.
Thank you. Mr. Katsonga, your preoccupation with the demolition of account number 1.
Yes.
Doesn't seem to take into account the fact that if you demolish account number 1, which is a consolidated fund, you are creating some chaos, because then it means that money that's coming in as revenue, you know, those different sectors have the freedom to spend it willy-nilly. How do you take into account that possible chaos that could arise if you demolish the account number 1?
You have not read our 20-point plan. We are opening central government account where relevant taxes will go and other inflows. And we are opening collection accounts in all districts where direct taxes like VAT, like pay as you earn, will go at that level. So both streams of government will have money. Nobody will be starved of money. We are looking at proportions of 60-40. 40% for central government, 60% for the rural.
I promise.
Only then.
I promise to go back and read your manifesto.
Thank you so much. I'll give you a copy today.
You, dear.
I haven't read his manifesto, but I disagree with the closure of account number 1. But what I do agree is that this is obviously an issue that relates to public financial management. We have no right as a nation to demand assistance from our donor or cooperating partners if we are unable to manage our public purse transparently and to make sure that our resources are going to those who need it the most. And therefore, we have a very clear plan of how we're going to beef up the public financial management systems, the auditing and accounting and procurement systems within government. I will make this pledge today. The effects of Cashgate have seriously undermined our financial system, and the effects of Cashgate are far-reaching. I make this pledge that within the first 100 days, we will robustly deal with the issues of Cashgate. And our administration will bring those responsible to book, and the resources which will be recovered will be brought back for the benefit of the people of Malawi. We will also make sure that we bring in an independent auditing company to beef up local systems and government systems in order to bring credibility and restore credibility to our financial accounting systems. On the population growth, we have realized that 80% of girls get married at the age of 15 or fall pregnant. We will make sure that we incentivize girl education to make sure that we keep the girl child longer in school, because it's quite obvious that they're not getting married to their contemporaries, but they're getting married to or getting pregnant to older men within the society. So we're going to incentivize girl education. We're also going to make sure...
Thank you. Thank you. Mr. Muluzi, I would want you to comment on the fact that the UDF, which we commend as the party that ushered Malawi, the party which was the, how do I describe it, ushered Malawi into multi-party politics. And so you were like the midwives of democracy. And we can't wish the UDF away in that regard. We commend you highly. But at the same time, you're coming into power, ushered in the breakdown, some major breakdown insofar as the civil service is concerned, which means in some sense, we could say that Cashgate, if the UDF had been a little more vigilant, then obviously Cashgate would have been nipped in the bud. How do you hope to do things differently?
Well, the causes of Cashgate and corruption are weak public financial systems within government. These are the causes, and we want to make sure that we have these institutions that oversee the implementation of the public purse are adequately funded, adequately staffed, and we bring in a new culture of accountability, transparency at the heart of cabinet and government. This is our pledge, and this is our commitment to the people of Malawi.
Thank you. And then finally, last but not least for that question, DPP.
Yeah, thank you very much. The question of healthcare financing, I think, is a very important question. I quite agree that the funding in this country is inadequate, but also we have another problem, which is waste and corruption. This week we heard about contracts which were given to people who were not qualified, or people were paid upfront before they even supply their drugs. So we need to improve that. There's clear a problem there. Now on the question of financing, but the essence of your question, I think we need to bring the private sector into the healthcare industry. In most countries, at the Western countries anyway, at 80 or 90% of the hospitals are owned by the private sector. And if we need to bring big international corporations to get involved and invest in the healthcare industry in this country. On the question of insurance, the DPP is committed to that, universal health insurance. As a matter of fact, the DPP was the first party to provide health insurance for the civil servants. So we'd like to extend that
to other aspects. It's complicated, but we'd like to look into it. Now, the question of delivery of services, I quite agree that the medical profession, especially below the doctor level, has been neglected. I think our nurses are overworked, and we need to upgrade them in terms of training, but also salary. The issue of preventive health, I think is extremely important. Part of the cost is that people actually go to hospital for diseases which are preventable because there is no preventive medicine in this country. A good example, for example, blood pressure. Most people don't even know they have blood pressure. Or diabetes, for example, nobody gets tested. Because they don't even know that they have, and then they end up going to hospital and being very, very ill. We need to do that. We need to improve our nutrition policy. Children, from the time they're born, they need to eat properly, and they'll grow up as healthy adults.
Thank you. Thank you. That was Professor Peter Mutharika concluding the third segment of our debate, where we were focusing on financing of health services. This is the third and last round of the 2014 presidential debate, coming your way live from Hotel Victoria in Blantyre, and I'm your host, Patrick Sempere. Funso lathu lachinayi ndi lachichewa, ndipo amene atatitsogolere funso lathu lachinayi ndi Kamuzu Chiwambo. Funso limeneli tikufuna tiunike nkhani ya ubale ndi maiko akunja. Mundivomereza kuti chitukuko cha dziko lathu la Malawi chimadalira mgwirizano umene tili nawo ndi maiko akunja. Funso ndira kuti kodi Petra itatenga boma. Boma lanu lidzachitanji pa mgwirizano ndi maiko ena?
Mgwirizano wa maiko ena ndi dziko la Malawi. Ife ngati a Petra tifuna kuti tidzaonetsetse kuti ubale ndi maiko ena waima pa ma strategic interests zimene zikoza kuthandiza kuti tikafike pozidalira ife tokha monga mankhani ya chuma amene ndi masomphenya a Petra kuti dziko la Malawi likhale tigwire ntchito molimbika kuti tifike ndithu tikoza kuima patoka pa nkhani ya chuma. Nkhani ina ndi anthu amene timasankha ma ambassadors, ma high commissioners opita ku maiko akunjawo. Tisamasankhe anthu oti azikangolandira ma politicians akamachoka ku Malawi kuno kumalandira pa airport kumatenga ma suitcase. Iyayi tikasankhe anthu amene akhoza kuthandiza kuti akapeze ma business kunjako kuti akhoza kuthandiza dziko la Malawi kuzatsegula ma business kwathu kunoko. Komanso chinthu china tionetsetse kuti tikamasankha anthu ngati amenewa akazembe tisamasatire appeasement policy kungosangalasana. Iyayi nkhani imeneyi ndiyofunikira kwambiri kuti na dziko la Malawi likapindule. Koma chinthu china chimene ndikuonanso kuti nchofunikiranso kwambiri kuti zinthu zimene monga pakati pano pali mkangano waukulu pakati pa boma la Malawi ndi Tanzania. Nkhani imene yofunika kuti tikonze nthawi imeneyi. Komanso pafunika kuti pabwere utsogoleri wamphamvu, utsogoleri wozindikira chimene kuchita kuti amene akuvutavuta ku Tanzania ndi nyanja ya Malawi izi zithe. Chifukwa zimene zija zikuonetsa kuti zikhoza kubweretsa mavuto akulu kwambiri pa dziko la Malawi. Ndi mfundo zina zimene ife a Petra tifuna kuti tizakhazikitse pamene tidzakhala tikupanga mgwirizano ndi maiko akunja zikomo.
Malawi Congress Party.
Ine ndivomerezana nawo Kamuzu Chiwambo. Chifukwa Malawi Congress Party tayika mtima wonena kuti ubale ndi maiko ena ukhale ubale wothandizira Malawi. Panopa zachuma zapita pansi, tufuna kuti makampani akuno mogwirizana ndi makampani akunja azigwira ntchito pamodzi koma mothandizira kuti Malawi aphunzire zambiri, apitirize koposa mabizinesi akuno akhale wochita bwino kwambiri. Ubale umenewu ukhalenso wokhazikika pakuti anthu amene amatiyimirira ife kunjako akhale anthu ophunzitsidwa bwino, career diplomats, komanso iwo amene akhoza kumayimirira zoti tikhale ndi misika kunja ya katundu wathu amene tizichita kuno za ulimi zija, komanso kuti iwowo azigula zinthu kwa ife. Ngakhale kuno ku SADC region tigwirizane bwino ndi anzathu kuti tikhoza kuma sinthana katundu kuti tikatero dziko likhalanso labwino koposa chifukwa li mchuma chomayendetsera zinthu zake. Nkhani za phokoso ni zina ife timakhulupirira kuti tizikhala pa ubale wabwino ndi abale wathu onse otizungulira, ndipo ngati zinthu zina zavuta timakambirana, ndipo timalola kuti malire onse amene alipowa tizichita mogwirizana kuyambira nthawi imene zidayikidwa kuti malire ndi wotere chifukwa tonsefe mpa ubale wathu. Kaya anthu apita ku Joni, kuli abale wathu ku Zambia, ku Mozambique, ku Tanzania, tonse ndife pachibale, koma tikambirane bwino chifukwa malirewa tilachita kuwapeza zokhudzana ndi history ndi malamulo azina ndi zina. Titsatire zimenezo ndondomeko zake. Ine ndikukhulupirira kuti tikhoza kukhala bwino zedi, koma tilimbikitse za malonda. Wonse obwera kuno azitithandiza kuti dziko lipite patsogolo osati lilowe pansi ayi.
Zikomo kwambiri. Maofesi athu aukazembe m'mayiko osiyanasiyana nthawi zina kumakhala ngati kumtaya koti munthu akalakwa kuno timtumize kumeneko ngati chilango. Ndipo mwina ambiri anthu otelewa pano pati ukamba muno ali maofesi osiyanasiyana m'mayiko ambiri. MCP mutatenga boma muchita chani ndi anthu amene ali ku maofesi akunjawo ngati kumtaya mwina alibe zowayenereza kugwira ntchito imeneyo, mkachotsa ntchito dziko lilipiranso mamiliyoni compensation?
Ngati ndi wofunika kuti tiwathandize kuwaphunzira, pamakhala skills transfer pa ntchito iliyonse munthu imene wagwira kolingana ndi zimene zikufunikirazo. Ife sitikunena kuti anthu aja achoke, koma tikukana zomatayira anthu ku embassy kapena kutenga abwenzi wanu ndi abale wanu kumapiritsa ku embassy pamene sakudziwa zimene ayenera kukachita kumeneko. Pakhale sukulu zake zothandizira anthu otere